Good evening, I'm Grissom, and welcome to our live coronavirus pandemic special report. Today is National Nurses Day, so a shout out to all of Long Island's nurses. Tonight we have a doctor from Long Island Jewish Medical Center to help you sort through what's going on with COVID-19 in our communities and across the region. It does not discriminate. And we want to hear from you. This is a call-in show, so call us at the number at the bottom of your screen, 516-393-1800. Well, Governor Cuomo was on Long Island today, and he says New York may have turned a corner in its battle with the coronavirus, but hundreds are still testing positive every day. The governor found it pretty shocking to learn that most new coronavirus hospitalizations are people who had been staying home, or at least saying they have, and not venturing much outside. He says the survey results came from hospitals around the state involving about 1,000 new COVID-19 patients. And here's where we stand today. These are the numbers. Statewide, more than 321,000 confirmed positive cases. That's since March. In Nassau County, the executive, Kern, says that only 10% of those tested in the last 24 hours came up positive for the virus. She says that number continues to shrink. That's good news. Long Island now does exceed those 76,000 COVID-19 cases. And the governor cautions when all is said and done, he thinks death toll numbers will be much higher and much worse. Meanwhile, today, Suffolk Executive Malone reports a significant drop in the number of people hospitalized with COVID-19. Now that comes after 2 days of a slight uptick of COVID hospitalizations. More than 321,000 New Yorkers lost their lives to this deadly virus. Let that sink in for a second. That's since March. 321,000. 31,000 of those human beings right here in Nassau and Suffolk. All right, let's get right to our conversation. Joining us tonight, Dr. Fred Davis, co-chair of the Emergency Department at Long Island Jewish Medical Center. Thank you so much for what you do every day. You're one of the heroes on the front line, and thank you for taking the time to talk with us. You and I were talking before the show, and I think this is important information because you were saying that you're seeing a lot of non-COVID patients, or at least some, coming into your to the ER now with some pretty significant issues, right? Tell us about that.
Yeah, so I think one of the things we're starting to see now is as the numbers start to drop, we're starting to see a lot of the emergencies that came in regularly with people that are coming in for heart attacks, for things like strokes. Unfortunately, because I think the fear of us wanting to stay home to avoid infection, people have delayed their care. Hospitals have worked really hard to make sure that there's areas in which we can see patients safely and reduce the risk of getting infections from COVID-19 and be able to see these patients in a timely manner. And I think people have, because of the fear of getting an infection, coming to a hospital where they know there's a lot of people with the infection, I think have delayed their care. And I think that's something that's really cost them some time in which we can intervene with some of these emergencies.
Yeah, and so, some of that, if they wait too long, that can be permanent, right? They can have some real serious issues.
Sure, there's things that are very time sensitive, things like heart attacks and strokes that require you to act quickly in a timely manner that can really affect the course of their outcome.
Yeah, all right. Well, let's go to the phone lines right now. I know that Sharon has been holding for a while from Farmingdale. Sharon, you there?
Yes, I am.
Oh, thanks for calling, and what's your question?
My question is, assuming that you can socially distance in a private saltwater pool, is it advisable to do so? I have a teenager at home who's looking to invite 1 or 2 friends over.
So that's a very interesting question. I think, especially as the weather starts to warm up and pools start to open, I think that's very much of a concern. The virus itself, has been reported to live on different surfaces, especially even in water. But I think one of the things we know is that large bodies of water really dilutes the virus. And from what recent accounts and recent studies, there's been no accounts of specifically contracting the virus from direct contact with water. It usually is direct contact. So as long as you can social distance yourself far enough that you're really not worried about the aerosolization or people coughing and you're in a direct line of sight, I think you should be okay. But again, you always want to take the right precautions. And if you're in even a close contact area, obviously wearing masks and taking precautions about proper sanitation, hand hygiene in those situations as well.
Okay. Let me follow up on that as well, because I know the governor came out today and he said that he seemed flabbergasted by the fact that there were 600 cases in the last 24 hours, and we're all social distancing. We've shut everything down, and about 60% of these people claim that they're social distancing and are staying home. They're non-essential workers, basically. Is there something we're not doing? We're wearing masks. Are we not wearing gloves in grocery stores, or do we need to do more? Do we need to wipe down the boxes or leave the mail for hours and hours on the table? Or is there more advice that you can give us?
And I think that's one of the things we don't necessarily have a strong handle on. I think we have to be vigilant. The virus is still out there, and it could be that one time we touch our face without washing our hands beforehand, or touching something that was contaminated that leads to something like this. I know people are overly cautious in things like wearing gloves, but we forget that those gloves, if we don't take them off and wash our hands afterwards, could also be a source of infections. I know there are people who definitely will consider wiping down everything and before they bring it into their house. But I think the main key is making sure we practice the right measures of anytime we touch anything, before we're going to eat, before we touch our face, make sure we wash our hands thoroughly after each contact to really reduce the risk.
Okay. Back to the phones. Maria from Old Bethpage. Maria, you there?
Yes, hi.
Hi. What's your question tonight?
Yes, hi, Dr. Davis. I just wanted to know, if someone had the COVID virus, about a month ago, it's about a month now, and I know that one of the symptoms is you lose your taste and smell, and it's over a month, and they still don't have the taste and smell back completely. It comes and goes. I'm just curious, is there any time frame that it would come back?
Sure. So obviously, one of the things that is more common with this is people that are losing their sense of taste and smell. We've seen that last for weeks to even, now we're in about the 6-week point, and people still haven't had a full return of that. It's tough because it is involving part of the nerve cells that are involved in smell. That really involves both your smell and taste. And I think those cells turn over at a lot slower rate. So those are one of the things that you're really not going to see for a while before a full return of that. But most people will start to have a slow recovery and then eventually get to hopefully where they have back to where they normally were. But it can take some time.
Okay. How about Susan from Seaford? Susan, you there?
Hi. Thank you for taking my call. So there's a lot of talk that the New Yorkers are getting cases from Europe, and California and on the West Coast are getting it from China. Are they one and the same strain? Are they two strains? And if they are two strains, if I travel to California, if I've already had the New York virus, could I get the California's version?
So there have been reports that there are a few different strains, particularly an Asian strain and a European strain, that have been isolated. Parts of that they have been tracking and have been seeing where it disperses to. And there is concern that those strains can mutate so that we are seeing variations of different strains, and can explain why there may be more severity, say, in areas of New York as opposed to areas of California. Can you get it again? That's a great question that I think a lot of people are trying to really answer. I think that they have seen cases in Asia where people have contracted the coronavirus again with symptoms, but not as severe. So the hopes is that should you have had it, maybe you have some immunity, but we don't know 100% for sure. And with that fact that there are variations in strains, there's a good chance you could get it again. So you definitely want to make sure you take all the same precautions as if you never had it and could possibly get it again.
Wow. All right. How about Joan from Glen Cove? Joan?
Hi, Dr. Davis.
Hi.
Hi. Why does someone lose their sense of smell and taste once they have COVID-19?
So these are all things I think we're going to learn a lot more about as time progresses. But one of the theories right now is that as the virus invades certain cells, one of the areas that they think it might invade is into nerve cells. And the nerves are responsible. The olfactory nerve is really responsible for our sense of smell, which partakes in taste as well. So that there's a theory that invades into those nerve cells where they then replicate and cause some way reduce the transmission of how we will taste or smell. And so that we'll find out more, hopefully soon, of how that really occurs so we can better treat those things. But right now, all we have to say is we suspect that it invades those cells, and that's how it causes the damage it does.
Is it unusual for it to also manifest itself like with the COVID toe or Kawasaki syndrome or disease? Is that unusual for a virus?
So this was things that we definitely didn't hear about before as it infected other countries. But as we're starting to see more and more of these cases, we are starting to see dermatological symptoms in kids when we heard reports that it didn't necessarily affect kids. We are starting to see things like Kawasaki's that have been attributed to an offset of the immune system because they were infected with COVID-19. So these are cases that we're starting to currently see now here in the States.
All right. We're going to take a real quick break, and we'll come back. We're going to have more expert advice on how to keep you and your family safe from the coronavirus. Remember, we want to hear from you. Call us with your questions. Number's right there at the bottom of your screen. Again, 516-393-1800. We'll be right back. Welcome back to our live coronavirus pandemic special report. Let's bring back in Dr. Fred Davis, co-chair of the emergency medicine at Long Island Jewish Medical Center. I want to follow up on something that we talked about right at the beginning of the show, where you were cautioning people, don't stay sick at home. That could have some serious consequences. When do you anticipate things opening up to where elective surgeries are more routine at hospitals?
I think that's coming closer. I think we're at the point where we're able to really have isolated and cleaned areas and made sure that the hospitals are safe, and really even dedicated certain even hospitals for these cases. I'm hoping that comes sooner rather than later. I know a lot of people have been waiting for surgeries, for interventions, especially people that have cancers that really would help with getting their surgeries earlier. So I'm hoping that happens soon. I know we're really waiting from the governor to really give us the okay finally to be able to do that.
Okay. Back to the phones. I think, is it Mary from Lynbrook?
Hi. Yes, thank you, Dr. Davis, for taking my question. I've had symptoms starting back in early March, and March 14th I did take the test, and it came out negative. And the symptoms persisted, which are sore throat glands. Thank God I haven't had the trouble breathing or had to have been hospitalized, but the symptoms have continued with throat glands, headache, chills, tired, and then April 14th I did test positive, and then I realized I had to self-quarantine. So I'm wondering, does this virus ever last 8 weeks or more? Because I haven't heard that before.
Okay.
So the variations of which it lasts is variable depending on the person. People's immune systems react very differently with this. Very early on, people will get a cough and very mild symptoms that include like fevers, even body aches, and then can progress. When it progresses, sometimes that can last a bit longer when you have very severe symptoms such as the shortness of breath. Again, maybe early on, it's really tough to say if you tested negative. That there could have been some other symptoms going on. There's many other viruses, especially this time of year when we started to see other viruses that were high in our current population. And then eventually, obviously, as we progress further, the majority of the viruses that we were seeing that people were having symptoms with were COVID-19. So it's very possible you might have had something early on and then contracted this virus after that. And that's why you might have had this prolonged symptoms as long as you have had them right now.
Okay. How about Francine? Are you there?
I am.
What's your question tonight?
I have two quick questions. When you're out and about in the supermarket or the drugstore and you're wearing shoes and you come back in the house, do you bring in the contamination? And also, in the morning, I bring in a newspaper that's in a plastic bag, take it off, wearing a glove, put it on a glass top table to begin reading it. Am I bringing in the virus?
So definitely, as part of your first question, when we start thinking about where we've been and what we've walked around, there's always a chance if someone sneezed or there's some aerosolized droplets that landed on the floor, there's a possibility. We don't know if those necessary droplets are infectious, though. As you have more time that something lasts on ground or other surfaces, the virus slowly will denature and start to die off on its own. And so obviously good precaution would be, to keep your shoes in a place where, they're not, walking around in the kitchen where you might drop something and accidentally try to, pick it up and clean it up. But maybe keep them in an area where you first walk right by your door so that they're there and it's a safe space where you can have them. As far as the newspaper, well, usually when they're in plastic bags and things like that, that does prevent them should they have some kind of possible contamination before being delivered. I know that there are cases where the virus can live on surfaces for hours and days. So I think if you're doing the right thing where you're wearing gloves and then throwing the gloves out, making sure you're not touching your face or remembering that you had the gloves on and washing your hands afterwards, I think you're probably safer than you think at this point.
Okay, let's try to squeeze Paul in. Paul, are you there?
Yes, I am.
What's your question tonight?
Yes, how you doing? I'm a little nervous here because I never spoke like this. Okay, how you doing, Doc? Okay.
Yeah, good. How are you?
Okay, the question I'd like to ask you, okay, I have a mom who's 92. Okay, she lives in a residential place, and, respectfully, I don't really want to say where it is, okay? But the question I want to ask you is, she has not a roommate, but a gentleman next door who's really sick. I don't know if he has the coronavirus and everything. Now, the question I want to ask is, if it gets better and everything, and if he goes in the hallway, just going in the hallway, could my mother catch it if he has a coronavirus?
Okay, I'm sorry, Paul. We got she can catch it in the hallway. We got like 15 seconds, Doctor. I'm sorry.
Yeah, no problem. So there's always a possibility. Obviously, the best thing would be to make sure that she's wearing a mask if she can when she goes into the hallway to really reduce her risks. Also trying to make sure she, again, proper hand hygiene, washes everything appropriately, washes her hands before, eating or anything along those lines to reduce her risks and chances.
Okay, and unfortunately, that's all the time we have. Thank you so much, Dr. Davis, for everything that you're doing, and stay safe and stay healthy. And thank you, and we'll see you tomorrow night.